Hello, snoring and obesity. That's the topic we are going to discuss today. Everybody knows what is snoring, and everybody at least once they were snore in their lifetime. And it's very common. Snoring is very common, and it can even considered as a very normal phenomenon. But only if it happens in the children, it has to be taken very seriously. Or with people with obesity, it has to be looked into. Okay, what is snoring? Snoring is a harsh sound which is generated by the vibration of the tissues in the upper aerodigestive tract. When the air enters, the tissues they vibrate because of the narrowing or because of the flow of the air. So the vibration makes a sound that's called snoring. Okay. What is the big difference in a normal person snoring and an obese person snoring? If a normal person snoring, it can be considered as a normal one, or maybe if he's very tired, he may be snoring, or if he's little diseased or recovering from the disease in the convalescence period, they can snore. But if an obese person snores, it could be a normal one, but it has to be seen little differently or maybe looked into. Why? The reason being, it could be a sign of sleep apnea or obstructive sleep apnea, OSA, or a simple sleep apnea, which is a deadly disease where even sudden death can happen during the sleep itself. Without any reason, the patient may die suddenly. And not only that, it could be a cause for obesity, it could be a cause for uncontrolled diabetes, or it could be a cause for hypertension, it could be a cause for tiredness, all this irritability, all those things could be because of the sleep apnea. Okay, normally how to differentiate between a normal snoring and a sleep apnea. When an obese person, when he has when his sugar is not under control, he's gaining weight, his BP is not under control, and his hormones are not under control, and he has a daytime sleep. Suppose daytime he sleeps a lot, or in a sitting posture, if he sleeps easily, then definitely there is sleep apnea, and it has to be evaluated by the pulmonologist or by the obesity surgeon with a sleep study and pulmonary function test, and he needs to be treated seriously. Okay, why he sleeps in the morning time or in the daytime or in the sitting posture? Generally, suppose an obese patient, with the tummy is sitting, the gravity pulls the stomach, all the diaphragm, everything is pulled down. So the lung is little expanded, and easily the air can enter, the oxygen can go, and the oxygen can reach the brain. So the brain usually relaxes and he goes for sleep. But at the same time, suppose in the night, suppose he goes to the bed and he's sleeping, the tummy itself will pushes the diaphragm, and the diaphragm elevates the lungs. So the air entry or the capacity of the lungs reduces. One. Number two, because of the snoring and narrow passage, the air entry itself is very low. So the oxygen level goes down, carbon dioxide level increases. When the carbon dioxide level increases, the brain becomes alert. The brain will not take rest, will not sleep at all. So what it makes it, the person will be, snoring, then, he'll be turning here and there, he'll be tossing in the bed, then, he goes sleep for 5 minutes, then again he wakes up. He may not physically get up, but he wakes up from the sleep and takes a deep breath 4 or 5 times, then increase the oxygen level, then goes again sleep. So this process keeps on going. So naturally sleep is disturbed. So you'll be sleeping very lightly, even in a dreamy state, you'll be sleeping. So the next day morning they wake up, they won't feel relaxed, they don't feel refreshed. So they feel tired and irritated. And of course, when they're sitting in the morning time watching TV or driving car, the oxygen, the diaphragm goes down, oxygen goes easily, oxygen reaches the brain, and they go for sleep. So any obese people with the snoring, if they have a daytime sleep or sitting posture sleep easily, then they have to consider themselves as having sleep apnea or obstructive sleep apnea. They have to see a pulmonologist or the bariatric surgeon and to be evaluated with a sleep study and pulmonary function test. And this sleep apnea can cause hypertension, can cause diabetes, or if the diabetes is there already, it won't, will not allow the diabetes to get controlled. It can cause, extreme tiredness, irritability, their efficiency of working and thinking will come down. So this is very important. Not only that, this sleep apnea can cause sudden death without any reason. They will stop breathing during sleep itself. So snoring and obesity, it could be a normal one, but if an obese person has uncontrolled diabetes, hypertension, and daytime sleep, especially daytime sleep, they have to immediately go and see the specialist. Thank you.